Good morning, Mr. Chair and Commissioners. I'll just go through some of the numbers, the current numbers that we have. So you can see that our number of positive cases is 1578. That's for Clay County. We have over 104,000 total confirmed positive cases throughout Minnesota. We're at 41 deaths. We had that additional death, I believe it was last week. So we were at 40 for a long time, and now we're at 41. The number of deaths in Minnesota is over 2,000. In the United States, it's almost 210,000. But then globally, it's over 1 million now. So a number of deaths for COVID. We have our 14-day case rate per 10,000 people, and that's the one that we are working with K-12 schools. They use that as one of their data points in regards to determining their learning model in their school system, as well as many other items that they're considering in their school. They have a guidance from MDH. So this is just a data point that they're also considering, and it's at 40.92. So if it's, the recommendation is, if it's over 50, then the schools would really be looking at all distance learning. But at 40.92, it's remained consistently around that in the last few weeks. In Clay County, currently, we have around 7 that are hospitalized for COVID, and then we have 1 that's in ICU, so the numbers are low. We still have capacity, according to Sanford and Essentia. There's still plenty of capacity for those that need hospitalization or intensive care unit beds. I think that's it for the data. Do you have any questions? And then I'll turn it over to Cheryl to talk about our testing site information from last week.
Okay. Kevin or Jenny, you have any questions concerning the data?
No, thank you.
Okay. We'll move on to Cheryl. Are you taking that next?
Yeah, so last week we had our No Barriers community testing event at the Moorhead Armory that ran last Tuesday, Wednesday, and Thursday. So on Tuesday there were 510 people that went through. Wednesday was 429, and Thursday 430, for a total of 1,369 individuals who were tested. There still are some tests that are being processed, but so far we have 68 individuals that were positive out of that. The event, I believe, from everything, we went over there a few times during the course of the week, went very smoothly. People were very happy that they had an opportunity on this side of the river to get tested, so I think it went well.
I think they handled it very well out there. I did go through it myself, and it went very well. They had good people out there working on it. And I think the test right now is not as invasive, or whatever you're going to call it. It's just sort of they only go in a little ways, and it's not as offensive as it was before. So
Right, they were using the nasal swabs for last week's testing versus the nasal pharyngeal that goes much further up.
yeah.
So I also wanted to mention too is that we are having a county employee flu shot event this Friday. I believe Kathy sent out an email to everyone yesterday. We're trying out a new system for scheduling so that people can pre-schedule themselves for their own appointment and can also enter in their demographics and their insurance information. So if anyone has any questions, you can certainly call our clinic at 218-299-7777.
So where are those? Where's that going to be happening at?
That is going to be in the Family Service Center in Meeting Room 4 this Friday, October 9th, from 8:30 to 4:15.
Okay, thank you.
Thank you.
Do you want to mention other opportunities?
Yes, we will. There's also other opportunities, of course, in the community to get flu shots. I believe Sanford is doing some Saturday drive-through clinics. Essentia is doing something similar. I don't have the details of that. And of course, all the local pharmacies, I believe, are also offering flu shots. But if anyone is not, of county employees are not able to attend on Friday, I have been getting some emails, so we'll certainly try to be flexible and make sure that they have an opportunity to get in and get done. Also wanted to mention for county employees, if you have family members that are under your county insurance, they are welcome to come as well. They just need to get registered or scheduled.
Okay, and again, this is just for county employees and their families or?
Correct.
Okay.
Thank you.
Jamie?
Good morning.
Good morning.
I just want to talk a little bit about testing and then also to just do some clarification on isolation and quarantine in Minnesota. So testing, CDC and Minnesota Department of Health are really focusing on identifying asymptomatic individuals in the community or pre-symptomatic individuals. So what they're trying to do is provide more opportunities for testing for people that are not able to go into their healthcare provider and get tested. An example was the event we had at the Armory this past week. So right now, if you have symptoms or if you've been identified as a close contact of someone who has been tested and confirmed to have COVID, then you can go to your healthcare provider and be tested. But giving the opportunity to be tested in the community like we had last week allows us to see what's out there, and to anyone who's asymptomatic or pre-symptomatic, not having symptoms, can be tested if they identify, even though the numbers are low. We already have 68 in our community that were identified as positive, who can then be isolated. And so that means what isolation means, and there's some confusion with isolation and quarantine, so we wanted to clarify that. But isolation means a person has been confirmed to have COVID. And so what they do is remove that person from others until they're well. And so there's an automatic 10 days, and it may even extend after that. They have to be fever-free for 24 hours. So if you think about it, that person is known to be ill and to be contagious. So we're removing them from the community, and that means staying home the entire time. And so then if a person is quarantined, it means that they were actually exposed to another person. And so it's confusing to people because then you have to stay home for 14 days. And so the reason for that is any time during that 14-day period, you may develop symptoms. And so, or you may be actually asymptomatic, a person who's asymptomatic and also, positive, but you just don't know it. And so the removing them from the community for 14 days, having them stay home that entire time, is because symptoms can come between day 1 and day 14. Typically, it's during day 5 and 7. So that's where a lot of the confusion is too, because people are going to get tested. Well, in Minnesota, being tested it's like the Minnesota Department of Health, Chris Erzman, our infectious disease director, said it's not a get out of jail free card, like in Monopoly. You don't get to go out of quarantine if you were tested. And even if it's negative, because you could be positive on day 12, day 13, day 14. So there really is no need to be tested, but if you choose to be tested, you still have to stay quarantined or home for that entire 14 days. And really, if you did get tested, you would probably want to get tested again at the end of that 14-day period to be sure that you are truly negative. But it's not necessary if you just stay home the entire 14 days. There is a lot of confusion about that in the community, and people are getting mixed messages. But in Minnesota, it's basically science-based that is the period that you could develop symptoms. And so, again, it makes it much easier for us to really have a good handle on what's going on in our community if we have more and more opportunities for testing. So they are improving that. They're doing, if you've ever had a strep test at the clinic, they'll do a rapid test right there, and then they'll send it to the lab. So they're doing more and more testing, and so it will be available in our community for COVID as well. So
The question is, you're sort of emphasizing in Minnesota. Is it any different in North Dakota or Wisconsin or any other state? Do they do that?
the governor did announce some guidance in North Dakota last week, and so that's why we are saying that, because in North Dakota, what my understanding from the governor's press conference is that if they're wearing a mask, then they're not considered a close contact. But the science is not saying that if we're wearing masks right now and we aren't staying 6 feet from each other, that we cannot contract the virus. And so that's why we're stressing Minnesota is still following that. Even if you are wearing a mask, if you are within that 6 feet distance, and that's why we're spacing out 6 feet, because the best way to protect each other is to maintain that 6 foot distance, because when we're coughing or sneezing, or right now when I'm speaking, the virus can travel and it'll eventually fall down, but it can go that distance. So that's why the 6 foot distance is recommended. The mask is really helping for the splatters, you know, that's what it's doing, is preventing the splatters. So nothing has changed in Minnesota. We still have to consider a close contact anyone we were with in 6 feet for more than 15 minutes cumulatively. So that means if you were with someone, you know, for 5 minutes, talking with them in close contact, even if you're wearing masks, and then later you're with them for an extended period of time, it's a cumulative time of contact with that person who could potentially be infectious.
Has anything else changed in Minnesota as far as being open? Because I noticed now there's a bank, I saw the lobbies open, you know, before it was always locked, you had to come by appointments, but now the lobby is open. Are there some different things that have happened in Minnesota where we're changing as far as who can open, who can't, or?
Not to my knowledge. The guidance has been the same. If you're able to ensure that 6 foot distancing, then you can have, and part of it has to do with staffing levels. If you have a lot of staff that are out, or, you know, then each business is making decisions based on what their staffing level is and whether they're able to maintain that guidance of the 6 foot distancing and masking in their business. There was some new guidance that just came out for businesses, but it had to do with contact tracing within their businesses. And I haven't had a chance to review that, but that was the newest guidance that came out for businesses.
Okay, thank you. You look like you got more to say.
Just one more. I think it's on a positive note.
I can tell that through your mask.
I'm gonna get a mask that covers the whole face. Moorhead was picked for one of the 10 semi-permanent sites across the state. Now, I think we talked about Duluth opening up a saliva testing site. They were the first site, and they were open for a few weeks now. So we were just on a conference call yesterday, and Moorhead is one of the 9 other sites that they have chosen to set up semi-permanent. Semi-permanent meaning it'll probably go through the end of this year, but it'll be a saliva testing site. No barriers again. More information will come. We just had a preliminary meeting to say we will have a site. There will be no staffing needs for our public health department, so that is good. The company that's going to provide this will staff it, so there won't be additional burden on our public health department for that, but I'm sure they picked our site because of the upstanding public health department that we have. I'm sure that was a factor.
I think they
You don't have to put that down the record. Excuse me, Jamie, did you?
I was making a smart comment. I said, I think they call it the squeaky wheel.
Well, maybe I threw in a plug for Moorhead.
No, it is a good thing that they picked more. Good, very good. Yeah.
I think it gives an additional opportunity
Yes.
for people to get tested, and anytime you have an opportunity, we've had so many times where folks in Clay County went to a static site, is what they called it, in Fargo, and many of our citizens used that site because we really didn't have anything in Moorhead. So they were good stewards, allowing to include Moorhead in that, even like the higher ed testing. They did NDSU testing. The governor's office from North Dakota allowed our higher ed to be included in that. So they've really been great partners in allowing us to access their testing site. But this gives an opportunity for us to have one on our side of the river, and so I think it's great.
Yeah, I think we can see from the stats that are going on, this COVID is not going away yet, so.
Right.
It's still here, so caution all people to still be careful.
That's correct. Still wear your mask, 6 foot distance.
Okay.
You know, those are what our factors are right now before we get the COVID vaccine at some point.
Okay.
Okay. I have just one other quick, it's non-COVID related, but if you look at the FM Extra sometime when you get a chance, we have our resident expert tobacco coordinator who is talking about vaping and how that is exploding among teens. It's a huge problem. So anyway, recommend you read that. There's some very good information about the health effects, et cetera. So.
Yeah, I see that FM Extras give us some good coverage each week on our meetings and stuff like that. Very good.
Okay, thank you.
Thank you.
Thank you for coming and giving us your report again.